Pulp testing device. The dental pulp is a loose connective tissue in the center of the tooth. The main function of the pulp is to form the dentin that surrounds the dentin-pulp complex. The dental pulp contains numerous nerve fibers that extend into the dentinal tubules. Pressure changes in the dentinal tubules can stimulate the nerve fibers based on hydrodynamic theory of brainstorm. Cold stimulus causes outward movement of the dentinal fluids, whereas heat stimulus leads to fluid expansion and inward movement of the dentinal fluids. In inflamed pulp, the reaction to cold and heat are exaggerated and cause severe pain. In cracked teeth, bacteria infiltrate into the enamel and the dentin-pulp complex and cause pulpal inflammation and pain. Pulp sensitivity tests are an important part in diagnosis of pulp and periapical diseases and treatment planning. If pulpal tissue is severely compromised or it is necrotic, endodontic treatment or extraction is offered to the patient as treatment options. Pulp sensitivity tests can also help practitioners to distinguish between odontogenic and non-odontogenic paints. Currently, there are different pulp sensitivity tests to evaluate the status of pulp tissue. The most common tests are thermal and electric pulp tests. Different methods have been used to apply a cold stimulus on a tooth. They include ice wrapped in gauze, ethyl chloride, and frozen carbon dioxide. There have been different methods to apply heat stimuli on a tooth. They include warm water, heated gutta percha, hot burnisher, rotating rubber wheel, and System B. Another method of pulp testing is application of an electric current on the tooth stimulating a delta fiber present in the dentin pulp complex. Cracks in teeth can provide a gateway for bacteria to cause pulpal inflammation. To detect presence of absence of cracks, transillumination test is a helpful procedure. In transillumination test, an array of light is shined from different sides of the tooth. The illuminated light is reflected if it meets a crack, resulting in a light and a dark area in the tooth. Currently, a single diagnostic device capable of applying thermal and electrical stimuli and transillumination is not available in the dental field. Oftentimes, one of the diagnostic tests is overlooked as the current available tests and devices are crude and require different materials and techniques. A single diagnostic device capable of providing cold, heat, electricity, and light is needed to increase diagnostic accuracy and value of pulp testing. Recently, a company, Nuvotech Medident Incorporated, Vancouver, Canada, has developed a single pulp tester device, PTD, for dental pulp testing. This single unit is easy to use and is capable of providing safe and measured amounts of cold, heat, electricity, and light during pulp testing.